As a part of phase 1 of the reopening plan here in Massachusetts, dental offices have been given new guidelines on what cases they can and cannot treat right now. But questions remain about whether it's still too soon to see patients and if there's enough PPE to keep everyone safe. Western Mass News reporter Sabrina Riley spoke to a local dentist and a hygienist to get answers.
The typical sounds in a dentist's office are gradually increasing after months of limited emergency procedures.
As the governor now has moved into phase 1 of his reopening plans, dentistry is in that phase 1 in the sense that we are dealing with what's called a new definition of emergent care.
Dr. Vincent Mariano owns EMA Dental in East Longmeadow and tells Western Mass News that being in the first phase allows them to now treat patients with existing oral health conditions and any other cases they deem essential.
Well, according to the governor's plan, phase 1, this emergent care, which will be over the next couple of weeks, the soonest we'll get into what we're going to be calling elective care would be June 8th, and that is if all goes well.
While EMA Dental has staff working to treat emergent cases, come phase 2, he'll need all hands on deck to handle the backlog of patients. That said, many dental hygienists in the area are still concerned that by returning to work, they'll be putting themselves at risk.
Working with a very contagious disease, and it's airborne, and we're working very close to patients. Yes, it is a concern, but we usually in dentistry find a way to protect ourselves.
And here at EMA Dental, they actually have an entire room dedicated for their hygienists to get ready for patients in their PPE.
So we have a much better control of our environment now and protection for ourselves than we did prior to closing.
A fact that has calmed the nerves of Kimberly Jakowski as she once again heads back to work.
With the onset of COVID-19, we are now having to raise the bar.
All staff is fully equipped with the proper masks, gowns, gloves, and shields to keep them and their patients safe.
Dentistry in general and dental staff are certainly at high risk, and I can understand their concerns. But also, all healthcare workers, as we've seen on TV, are at high risk. The key is being prepared to move forward to the next level.
I think it's important as dental healthcare providers that we think about our patients and how much they need us. It's not just a cleaning or not just a filling, but it's oral health.
For Western Mass News, I'm Sabrina Riley.